Hey folks, the two boneheads are back. I'm Howard Lux.
I'm Jeff Berg.
We're two orthopedists bringing you a lot of experience. So today, we're going to talk about when less is more. What are we talking about when we refer to this? Go ahead, Jeff.
Yeah, well, you just put out a great post, Howard, that talks about this, and it's spot on. In this day and age, patients, perhaps other doctors, media, all push more testing, more imaging. And the problem is, and it's a really difficult concept to sort of get across, so hopefully we can clarify it, is that people think that our testing is so perfect that we can diagnose, make an absolute diagnosis, and then that helps us treat. But as you and I know, and as we've talked about, sometimes our testing and imaging sends us down the wrong path. And people who don't need surgery or don't need treatment or significant treatment that's filled with potential problems and complications end up getting things they didn't need because of our studies, not despite our studies.
Absolutely. I'm 53 years old. There's a decent chance, based on statistics, that I have a meniscus tear in my knee. Let's say I go outside and run, and my knee starts hurting, and I run to my doctor's office, and we get an MRI. We're going to find a meniscus tear. That could theoretically lead to an operation or a suggestion for an operation when, in fact, the meniscus tear was already present. It just happened to act up. People can't seem to grasp the fact that we know that a fair number of people our age have meniscus tears, have rotator cuff tears, have disc herniations, and they have no pain. Those are really hard conversations to have in the office with people to let them know that they need to live with these things.
Yeah, I think, one of the hardest things to get across is when I start to go down this path with patients, particularly patients, our age or older, they think that what I'm suggesting is that we should put them out to pasture and they shouldn't be active. But really what you and I are saying is that there are dings and scratches and frays in patients as they get older, just like they are on your car and your jeans and everything else as it gets older. But that doesn't mean it's not good. And the problem is the MRIs, it's like looking at the cracks in the ground with a magnifying glass. It picks up all kinds of noise and it starts telling us this is torn and this is torn and this is cracked. And then if I want to operate on somebody, I get an MRI because it's going to tell me there's a problem. And a lot of times that might not even be the problem. Listen, I see a lot of young people who have shoulder pain and no rotator cuff tears. And even if a person our age, we get an MRI, and as you said, 50, 60% of those people might have a rotator cuff tear and didn't even have any pain with it. Now I get the MRI and it shows a rotator cuff tear. Well, MRIs sometimes are good at showing me what exists, but not what the problem is. And particularly not what the problem is, but not what the treatment is for sure. So, yeah.
Absolutely. And it's amazing because they'll come hobbling into your office, with an acute injury to their knee, and they can't believe that the pain is ever going to go away. They get this feeling that they're broken. What do you mean I don't need an operation? Of course I need an operation. Our job is to amuse the patient while nature heals the problem. Yes, most of the time you can go back to running. And it's really a tough message to nail home. It's not that I want to leave you in pain. It's that I know that you have a good chance of getting better without me touching you.
Absolutely. And sometimes, unfortunately, if somebody operates on you, you're worse and perhaps permanently. So the real trick for us as an orthopedist is to try to define which problems need my treatment and which problems don't. And then from that, what do I do with it? And sometimes we use different things. We may talk to the person. We may examine the person. We may see how they respond to treatment. That's how we make our diagnosis. Sure, MRIs and studies can help us, but they need to be used in the appropriate way. And sometimes they can mislead us.
That's right. It's really, I'm always amazed how I go to examine someone and I ask them to take their shirt off so I could see their shoulder, or roll up their pants so I could see their knee, and they're shocked. because their previous doctor didn't examine them. They just ordered the MRI and told them what they need done.
Yeah, and well, the same thing, even just trying to talk to a patient. Many patients come in and they want to know what you saw about their MRI. I haven't
Right.
even talked to them. I haven't even figured out what the problem is. And what most people don't understand, they think of MRI like in Star Trek. I wave this magic wand and the diagnosis spits it out. The MRI is used, as you know, to kind of confirm what we already think's going on. And our biggest thing on figuring out what's going on is probably talking to the patient, secondarily examining the patient, and the MRI can help us confirm it or rule things out. But just using that MRI is dangerous, really dangerous.
I agree. I think this was a great talk this morning. Just remember, oftentimes in medicine, less is more. If you're sitting at a doctor's office and they say that you don't need an MRI, you probably have a great doctor there in front of you. Don't think that they're technologically ignorant. It really is the case. Less is often more. You're not broken. There's a good chance you're getting back to your activity or sport without surgery. Many of these things just get better over time.
Absolutely. Absolutely.
Take care.